Hi guys, I'm Dr. Heidi Goodarzi. I'm a dermatologist and pediatric dermatologist and mama to 3 lovely kids. I want to bring information about dermatology in general, but pediatric dermatology in particular to you. What better topic than acne? It actually makes me really sad to see all these teenagers walk into the office with treatments they have learned on social media and from celebrities or their friends that are absolutely wrong. There's a lot of good information on the internet, but it's hard to decide what information are good and what information are bad. So I want to start by saying acne is a skin disease. It's not just type of skin you have. Acne is a skin disease. Dermatologists are skin doctors. For every disease, there is a treatment. So please get your acne properly diagnosed and treated. And do this early because a lot of diseases don't lead to some permanent damage, right? Like if you have a cold, it's gonna pass and you're gonna get better. You may be miserable while you're having it, but it's gonna pass. But with acne, it almost always leads to scar. And acne scarring is permanent. I can treat your acne very easily. It's very difficult to treat your acne scarring, or at least treat it to a point where it looks like the skin you had before. So acne treatable, acne scar more permanent, very important. Get the diagnosis and treatment. If you don't have access to a dermatologist yet, your primary care doctor, your pediatrician, your internist, your family practice doctor is very capable of starting you on an acne treatment until you get to see a dermatologist for more kind of specific acne treatments. It is also very important to know that there are many different types of acne. Acne is not just one disease. We have comedonal acne, which is those blackheads and whiteheads you get. We have inflammatory acne, which are the pimples, cysts that you can squeeze and stuff comes out of it, and you should never squeeze them. And then we have nodular cystic acne, which is those deeper acnes that usually hurt. We have acne rosacea, which is more of an adult form of acne. Acne scarring, which also has multiple types. Sometimes only the color changes. So it's more in the shape of hyperpigmentation or hypopigmentation. Sometimes there's a divot, and then there's different types of those divoted scars that we define in dermatology. So all that to say, there are different types of acne that need different types of treatment. But almost everyone gets a level of acne because those teenage years where hormones are up and down, you see some form of breakout. I get a lot of teenagers in the office that say, I wash my face twice a day and it doesn't help. Washing your face is an important part of taking care of your skin. Whether you have acne or not, you should wash your face once or twice a day. But washing your face isn't going to prevent acne, and it's not going to treat your acne. You don't get acne because you have dirty face. You get acne because our skin has pores. The pores get clogged up. They recruit inflammatory cells and there's inflammation. So just by washing your face, you're not going to get rid of your acne. But good for you, continue washing your face. Do not overwash or over scrub, right? Some people get super excited about washing the acne off and then they irritate the skin, which in turn causes more acne. So you don't want to do that. Gentle wash twice a day. What about acne washes? There are many great acne washes on the market. Usually they contain either salicylic acid or benzoyl peroxide, both of which help unclog the pores and kind of fight the bacteria, but they are drying. Also, acne medications and acne washes work best if they're in the right combination. So sometimes when I put someone on an acne regimen, they say, well, I've used this one and it didn't help. I understand you use this one medication, but it wasn't in combination with this one and this one, with this wash and this other medication, so all of them could synergistically work and make your acne better. So trust that they have to be used in a good regimen together. So even though we will eventually tell you to go buy one of those washes, just using those medicated washes alone usually doesn't clear your acne. One of the most important medications that we use for acne, which is very effective against comedonal acne, but comedones are where the acne starts anyways, are retinoids. So whether you can use an over-the-counter retinol or a mild prescription retinoid, it would be extremely helpful to use it. Now, if I want to oversimplify the acne treatments that we use, is that we start you on an acne wash like benzoyl peroxide, a topical antibiotics in the morning, and a retinoid at night. And then we try this for a while if your acne is mild, and if we can't get results, then we start you on oral medication, and if it's even more severe, we start isotretinoin, or you may have heard Accutane, unless we get a patient with acne that has such a severe acne that we're really worried about scarring or about other problem that caused with acne. So then we may skip a couple of steps and go to the most effective one. But usually if you're young or if your acne is mild, we're gonna start stepwise and see what we need to do to clear your acne or get it to an acceptable place with using minimal medication. Again, you have a medical problem in your skin and it's best to get it treated. Now, you can supplement that medical treatment with products that you like to use and would help, but you cannot replace it. So let me put it this way. If you have blood pressure and you want to just treat it with nutrition and good diet and exercise, you may not be able to manage your blood pressure to a level that you want, right? But no one is saying that nutrition isn't important. We do want to start you on a blood pressure medicine because we are worried that high blood pressure is going to affect your body. And then we also tell you, please go do exercise and good nutrition to help. So this is the same thing. If you have acne and acne scarring, we're concerned that this is going to damage your skin for the long haul. So we do want to start treating your acne, and then you can do the lifestyle changes and the products, other things you want to do to kind of help the process along the way. But you do not want to ignore getting the proper treatment. One of the important things in terms of acne management is the products you put on your face. Make sure every product you put on your face, specifically your makeup, says that it's non-comedogenic, does not cause comedones, does not clog pores. You can usually find this information either on the product itself or on the product's website, or call the customer service line and ask them. If they don't know about the product enough to know if it causes comedones or not, then you probably want to avoid using it. Also, wash your face as soon as you get indoors. So if you have an event, if you have an outdoor activity that you need to use makeup or you need to use sunscreen, when you get home, wash it off. Sometimes these products, especially sunscreen, is sticky, so you do want to kind of make sure you rinse off everything before you go to bed, because your skin needs to breathe and rejuvenate overnight. Please comment below, let me know if you have any questions, subscribe to my channel, and let me know what videos you want to see in future.